There's so many factors. We have to have a multidisciplinary approach in ensuring that we're engaging these patients and being proactive about combating disparities.
We want to achieve a rapid disease control. We want to be able to prevent long-term organ damage.
It was very important to establish this diagnosis and explain this diagnosis to my patient several years ago in order to ensure that she understands the importance of monitoring for other manifestations of lupus that can occur. And in particular, the one that we worry most about is the onset of lupus nephritis.
Communication with patients following this lupus nephritis diagnosis is essential. And the roadmap is going to start at points where we're recognizing the diagnosis of lupus in the beginning, regular monitoring for symptoms and signs of lupus after the lupus diagnosis, and then usually a kidney biopsy is going to be carried out if lupus nephritis is a possibility. These are the essential first steps in the early phases of this journey, hopefully getting the patient towards clinical remission.
It's important to remember that clinical features are not always correlated with underlying renal pathological findings. We need a biopsy to know exactly what is going on in our patients. In addition to telling you the class of lupus, the activity and chronicity indices help to assess the extent of tissue damage.
As we identify more biomarkers and newer treatments, our treatment approach to patients with lupus nephritis may become more personalized.
The early diagnosis and increased access will help improve the treatment and the follow-up of patients with lupus nephritis. We can improve access to care by increasing the number of trained nephrologists and rheumatologists, especially in regions when we have certain populations with low socioeconomic status.